Welcome back. You're still watching the Daily Debate, and I'm honored to be having with me in the studio for tonight Dr. Amr Mabrouk, the Professor of Plastic Surgery at the Faculty of Medicine in Ain Shams University. Thank you very much, Doctor, for being with us tonight.
Great pleasure, sir. Thank you very much.
The pleasure is all mine. Of course, we will be shedding more light on the healthcare system in general in Egypt. In your opinion, what are the main strengths of the healthcare system nowadays? What is the current state of the system that we are having nowadays here in Egypt, and what are the biggest weaknesses that we should be working on?
Well, first of all, it's the most important thing in building a healthy society is to be investing in two sectors, which is health and education. Health is very important because without proper healthy citizens, you'll not be able to acquire any development or any state-of-art perfection of your economy or your country. And therefore the investment in the field of health is really very well appreciated. The project of the President Sisi in his tenure, during his tenure, first and second tenures, in order to improve the national health system is really very important. It started with the 100 million plan, or 100 million health plan, and it was aiming to reduce the affection of the infective hepatitis C. And hepatitis C is a very devastating disease that unfortunately has affected the health of millions of Egyptians. And it was a big problem that is definitely was prohibiting any progress in the field of healthcare. Mm-hmm. The idea that within such a short period you were able not only to eliminate the disease but also to increase the prospects of living well of all the infected patients, this is a great success, and fulfilling the dream of giving the medication to the whole of the infected population that was infected then and now. Definitely this is one of the trophies of this project. Increasing and broadening the experience of this hepatitis C program, we have found that there has been a program that has been interested in preventive medicine. The program that goes and reach, for example, for the cancer breast patients. The early diagnosis, as we know in medicine, the cancer breast is one of the very dangerous ailments that affect women, and definitely the women forming 50% of the society are not only forming it as in the labor force, but also in the education and care of the family. And a family that is unfortunately prohibited from a mother definitely will be a weak asset in the society. So the preemptive ways of early diagnosis, as we have taken in the medicine books, that cancer breast has an erratic behavior. The more you early diagnose it, the more you are successful in its management. If you just miss a period of investigation, or you are having delayed diagnosis of the patient could be doomed in a very short period of time. Mm-hmm. While early diagnosis can really help and give a successful, healthy life for the patient. So the program of early diagnosis, management and examination and teaching program for the patients to examine themselves has really helped very much to reduce the incidence of cancer breast and reduce the load, because once you have early diagnosed the presence of a tumor, you will be able to easily to remove part of it, not to do the whole radical procedures of the radical mastectomy, which were common for a very long period of time due to the late diagnosis. The third important pillar, which I believe is one of the very important pillars, is the spread of the National Health System Program. The National Health System Program has been a dream that has even fulfilled during ancient times. We know during ancient pharaonic periods of time, in periods of strength of the different pharaonic dynasties, there was a very central organization of medicine that was responsible for presenting free service to the citizens of Egypt. We have seen that 3,000 or 4,000 years ago, and the prospect of doing it and organizing it by having a doctor of the doctor of the king, that's the senior doctor, was responsible for doctors of different governorates and sectors, and presenting the service for free for patients, and the system or the government is the one which is paying for the doctor. And this system has been applied with success in certain countries like in Europe and the UK as a good example, and has failed to be applied in very major superpowers like the United States up till now, and about the Medicare. Here in Egypt we had this program. It has been limping for some time. Limping because of the increase of the population, because the severe problems of how to present this service in remote areas and how to be able to maintain this program of healthcare. And good enough is that the progress in work and giving great attention to this and investment, starting with smaller governorates like Port Said, Ismailia and Suez, where there is the National Health Service is going, and hoping for the ambitious program to engulf or involve the greater Cairo, not just Cairo, but the Giza and the Banha governorates or Qalibiyya governorates, which can form a huge part of the Egyptian population. This is not a far-fetched dream, as we were thinking, but definitely will lead to improvement. And perhaps the aim of making this NHS system overlapping and taking all the population of Egypt within in the year of 2030, and that is 4 years from now, is a dream that could easily come true, especially with the digitalization. You know that countries, for example, like Finland, which was one of the highest index of happiness in life, because it's not actually the word happiness is the word, it's the word of satisfaction. Satisfaction is that the citizen has all the things that will keep him satisfied and contained, and therefore this could lead to his own happiness. So one of these important containment is the proper health system, and they were able to succeed to put all the files of the whole population on digitalized, so that if the person is living in Cairo, and or for example we're talking about the Finnish experience, if he's going anywhere and will go to a clinic that is far away from his home, with just the password, the doctor or the physician in this hospital will be able to find all his information. When this is, we're talking about few millions of Finland, when we talk about 100 millions, and God knows how many will be in the year 2030, if we can put the medical files of the Egyptians on this filing system, you will know exactly who is having this ailment and how to treat him and how long he has had this ailment, and all the things are put on his database, and this can be easily traced through his national ID card. This is a very important pillar that cannot happen without the investment, and a great investment in the field of digitalization, which I believe is a very important step forward.
Yes, Doctor, you mentioned a couple of important points. One of them is that we need to be spreading the universal health insurance system more and more all over the country. But there are two models, one in Britain or the United Kingdom, like the NHS, as you mentioned, and the Medicare in the United States of America.
Yes.
Which way are we leaning towards? Are we leaning towards success for the upcoming 4 years, towards the vision of Egypt 2030, or failure like the one the United States has had in the past years?
Well, we cannot say that the United States has failed, but the capitalist system was involved that healthcare is supplied by insurance companies. If you are not having insurance, then you will have a problem. And then insurance is the amount of money that you spend to pay for your insurance to cover certain health expenses. And people who are coming from low income sometimes would sacrifice paying their health insurance, and therefore will fall from the net of protection. Here in Egypt, the idea of the fact that most of the people are having a job which could be related to the government or related to the workplace, if it's a private practice or whatever, then therefore they will be covered by their own health insurance, which could be generalized on the whole population. And the idea of the Egyptian umbrella or the safety net to cover the people who are in maximum need, and by this we are talking about the old and the impoverished people. And we know that Egypt has the young population of 60% of the Egyptians are less than 30 years of age. This makes the plan can be made. The plan can be designed, the plan can be maintained depending on the variation between Egypt and other countries. The fact of a young population is an asset, and this young population, once they are having a decent job, and this is how the economy will go in, then this will be covered by the insurance which will pay, or the taxes that will be paid by them or by the owners of their businesses to supply a decent health care that will cover them all through their lives. We know, of course, that the median age of the Egyptians was in the early 60s was almost 40 to 45 years of age, and it has improved very much. Now it is approaching 74 in men and 75 in females. During Nasser's regime, there was a great ambition to cover the whole country with units of basic health care and some central hospitals in the capitals of the governorates. At that time, we were less than 30 million people, and the system was working somehow by hook or crook, as they say. And of course, there was the lack of education. The lack of education was these units were supplying a decent treatment for blood pressure, the chronic killers, which are the hypertension and the diabetes and the bilharziasis. But the patients, because they were lacking the education, would take the pill of the blood pressure only if they feel headache, or they will take the pill of the diabetes if they are going frequently to the urine, to the toilet, and so on forth. But with the improvement of education and the improvement of the health awareness, which is a program that is going now. If you go into the internet now and you just write the 100 million health program, all what you need to do is to be literate and having a mobile, which is most of the Egyptians now are having. If you press on that, then they will find a few questions. What are you interested in? What do you want to do? Are you a woman who is in the fertility age? You should do the following checks. Are you a gentleman or a lady who is above 50? Go and check for your health, for your blood sugar and for your blood pressure in a mobile unit. So all these leading questions on using the digitalization of the digital age or the internet that we are all living through, if you seek for the information, you'll find it in these websites. And I believe this social networking system is very important in advancing the knowledge, the spread of information, because information is power and knowledge is power.
We need to be spreading information.
Yes.
But what about the spread of this program over the governorates of Egypt, 27 governorates, especially, as you mentioned, Doctor, the rural areas, the remote areas?
There was a plan, and the plan was going on spreading on the infrastructure, and that's why the President has increased the percentage of the GDP that goes to medical service. And this is very important. We have increased the amount of money allocated to the health service and to the education. And therefore, there are central hospitals that are built all over Egypt. And the other central hospitals, the older ones, have been renewed and remodeled. The idea is to have a plan. And the plan is that you have some central hospitals and referral small hospitals, and then also strengthen the units. You asked me in the beginning, what are the weak spots in this program? What are the things that can make a program like this, that ambitions fail? And of course, it is the number of physicians. We have 213,000 physicians in Egypt who are registered and have a license. But the rumors have it is that there are only 83,000 of them, 83,000 of them who are practicing actually in Egypt. What is acting as a sort of a projectile or projecting the Egyptian physicians away from service in Egypt are few problems that can really be fixed and mended. First of all, the availability of the medicine or the physicians. We know that the number should be 23 physician per 10,000. In Egypt now it is, unfortunately, it's about 8.6 physicians per 10,000, which is a very a big gap. What we need to do, we are investing in building medical schools, and a lot of students are having the chance to have medical education. Even the universities like Ain Shams University is having its own programs for increasing the number of physicians who graduate from our schools every year. The second important point is to improve the lifestyle of the physicians, improving the work hours, improving the respect and care for the physicians, and at the same time the new law that has been done or has been fulfilled lately about the medical responsibility. It has always to be that transparent. The transparency of these laws should make the people, or should make the physicians more confident in working and in helping their patients and in saving lives without feeling the sword of accusation of being negligent or of being uncareful with the patients. And I believe that this law now, with its new printout in the market, will definitely improve the lifestyle of the physicians. And the second important point, definitely we have to look about supplying a decent income for the physicians. Why should they leave if they are well paid and well respected and well cared for?
Is it just about the money, or is it mostly about the money for the physicians?
We cannot live on air, right? Money is...
My question is, this is the main attraction for them to be leaving the country, or there are other challenges for them that they can't be working?
There are a lot of challenges. The most important of all is, that's what I teach to my students in the School of Medicine. I have a program that I teach, which is called How to be a Full-Rounded Physician. And by this we teach them how to behave, how to treat their patients, how to deal with the relatives of the patients, how to deal with the friends and the enemies, how to have good habits and how to avoid bad habits, and how to have proper time management. We are having challenges, and we are now having a generation called Generation Z. And Generation Z are the people who have been born after 1995, and these are people who have a lot of anxieties, and these are now the young physicians. They have seen anxieties, they have seen the social networking going through them, they have seen a lot of things that are increasing their anxiety and increasing frustration. This is a whole generation problem in the whole of the world.
Yes.
So when we know that our young physicians are belonging to this generation, we have to give them the support, we have to give them the respect, and we have to give them the care, and we have to give them the education. So it's a multifactorial things that can really help the youngsters to get more loyal and stay. So it goes both ways, and they always say it takes two to tango, and the two is that the government gives, and the people have also to give back. So if the physician is respected and cared for and educated and properly paid, why should he leave? He will not. He will stay.
The universal health insurance systems, how can it be dealing with the challenges facing the system itself, facing the physicians, facing the hospitals, the whole public sector? Do you think that the system, the universal health insurance system, is dealing with those problems, paying well for the doctors and the physicians, especially in the governorates that it was applied in?
Let's talk about the program when it's going to be made in a place like Cairo.
Yes, which is the last phase, I think.
Yes, but it's important to know that Cairo has a lot of private and semi-private hospitals, and the national health system intend to make contracts with all these private hospitals in Cairo and other places. So by this way, by paying to these hospitals will accept patients of the national health system. So you need not to invest mainly in building hospitals or increasing the number. You can always depend on the private sector of the hospital, and even on other authorities' hospitals, for example, the petroleum hospital or the electricity hospital or whatever there are, or even the army hospital or the police hospitals. All of these hospitals can take a share in the NH system, and this is the idea, to use all the available hospitals to involve them in the NH system, and therefore there will be a chance to improve things. If the good intentions are there, definitely there will be a road to success.
When can we be seeing this system, the health insurance system, the universal health insurance system, be applied in the capital, Cairo, which is the last phase, the biggest governorate, the highest number of population within the capital?
Well, it was intentionally started to be in the smaller governorates to see the trial and error and all the fallacies to be examining this way of service. And that's why it has started in smaller governorates in Port Said, Ismailia and Suez, to see how successful it is. You don't need to start an experiment in a bigger city like Cairo, but definitely they will reach Cairo and work on it.
Yes, Dr. Amr Mabrouk, the Professor of Plastic Surgery at the Faculty of Medicine, Ain Shams University. Thank you very much for being with us tonight on the Daily Debate.
Thank you, sir. Very kind of you.
Anytime. And this brings us to the end of the Daily Debate for tonight. Thank you for watching, and goodbye.